Welcome to Hypnosis, Facts and Fiction. This week, the show deals with the topic of pain and how hypnosis can help to relieve it. I am presently with Denise JODOIN, nurse consultant and president of the Nurses Association in Private Practice of Quebec. Hello, Mrs. JODOIN.
Good evening.
Can you tell us a bit about the goals of your association?
Yes, the association wants to bring nurses together within the healthcare reform framework in order to redefine our role and our place in society.
And are we looking at a new definition of the role of the nurse?
We are. Nurses are more and more going towards a role that will give them a lot more autonomy, and they will be also much more present in all the programs of health promotion, and they're also getting more and more interested into alternative medicines and herbal remedies.
And do the nurses recognize the benefits of these alternative medicines, and especially hypnosis?
We do. Hypnosis for nurses is a great tool to help us reduce the anxiety, stress, and of course pain with patients, which means that we will also reduce the intake of toxic drugs, pain drugs like Demerol, morphine, or the like.
Do you have an example you can give us?
Well, we use that we can use it in the course of the exercise of our role, our profession. It doesn't have to be 1 hour session. It's something that we will do 5 minutes at a time with a patient when it's needed. So its application is varied, and the length of time that we can devote to using hypnosis is also different from one patient to the other.
And do you think that the patient should have the choice to use hypnosis in order to prepare for surgery or what may come after a surgery?
Well, we believe that patients have the right to proper information, and of course, they have also the right to choose, whatever means they want to have as a help. Hypnosis is one of them. We encourage that. And
what kind of feedback do you get from the patients who do use hypnosis?
Well, they feel, especially when it's a second experience and they can compare with the first, they feel more relaxed. They feel, of course, they're better prepared for the surgery, and they feel the healing process is also accelerated and helped, because a lot comes from the inner disposition and the stress of the person when we want to think about healing.
Right.
So people are usually very grateful if we help them use this means, as a, let's say, self-hypnosis technique that we teach them.
Okay, and do you find that there are more and more nurses that are interested in learning about hypnosis or that use it?
More and more nurses are interested. Some are already using it in the last 10 years. We saw it happening more and more, and we encourage them to take a special training for nurses so that they can really integrate hypnosis to their role in a very specific way. So we hope that more and more nurses will follow this trend.
And this training is provided by your association?
This training is provided by Mr. DELCOURT, who is working in collaboration with our group.
Okay, the president of the Association of the Hypnosis of Quebec. Okay, and well, anyways, I hope that the nurses do grow in number and use the practice. It seems very interesting, and well, good luck to your association.
Thank you.
And now let's listen to the answers from the people on the street to this week's questions.
Yeah, I'm not 100% sure. I wouldn't take my chances when it comes to pain.
That sounds very therapeutic, if that, because if they could give you a sense of no pain or something like that, that would be, I'd do that.
you can convince someone that the pain doesn't exist, then yeah, sure, I guess the pain would be alleviated. It would still be there, but it wouldn't be acknowledged, I guess.
I've heard cases of dentists using hypnosis, so I mean, a lot of pain is psychological, so I mean, if it works for people, that's the only gauge, I guess, that you can use.
Yeah, I believe so, yeah. Because prayer can do that, and so I think hypnosis in a similar way can do that too. It can put a person in a certain state where they can not feel pain.
If it could take away the pain, no, I really don't think so.
I think so because it can reduce pain. When the hypnotist hypnotized me about 30 years ago, he pressed on my arm very, very hard. My arm stayed straight out. It didn't move, and obviously it would have hurt had I not been hypnotized.
I'm now in the company of Jean-Claude ZEKRI, who's a hypnotherapist. Hello, Mr. ZEKRI.
Hello.
Can you tell us a bit how you think hypnotherapy helps to relieve pain?
Well, we have a long time realized that the threshold of pain goes up as relaxation goes down. So we're trying to bring as much relaxation to a patient and lower the level of pain as much as possible that way. That's the basic way of doing it.
Okay, and what kinds of pain respond the best, I guess, to hypnotherapy?
Well, we're talking about physical pains, mainly muscular pains, arthritis, childbirth, sometimes toothaches, and operations with dentists.
Right. Well, can you tell us a bit how the process works?
Well, generally, we have two ways of doing it. Either we go straight and we hypnotize the person when they have, for example, to go to a dentist and get a pain or a phobia, or we do self-hypnosis and we teach them how to cancel pain or at least alleviate it. So it takes a few hours of preparation, and usually it works well enough.
Yeah. And how exactly do you learn how to do this?
Well, it takes about 6 sessions, and so they come and learn it, and we bring them into going to hypnosis faster and faster, so that almost by a snap of a finger they go straight down into hypnosis. So it's an easy process, and usually there is some work to do at home. They still have to do it, not only at our place, at our office, but they still have to practice from time to time at home.
And you were mentioning before, like for different situations, like going to the dentist or childbirth. I'm sure for any woman who's going into childbirth, she wants to know how long the relief will last.
Well, the relief will last as long as they want. Once they're under self-hypnosis, it's very easy. It's up to them to decide how long they want it and for what occasions. So it's only a matter of deciding when they want it and when to practice it.
Okay. So basically until the child's 18 about.
That's right.
Okay. So how many times a week does one need to practice self-hypnosis that you just described?
Well, once you know how to do it, there's no more problem. You know how to snap into hypnosis and you go very easily. So you don't really need practice afterwards. But for the first 6 times, or at least the first 5-6 weeks, you really have to do it. You have to make it a principle to almost every day go into hypnosis and go faster and faster.
And do your patients give you positive feedback?
Usually yes. Although it's a very frustrating thing, because usually patients, when they're very nice, disappear and never come back and say, "Hey, you've helped me."
Okay. Well, do you find some people that doesn't work for them? Like.
No, usually they come to us and it's their last resource. Okay. So usually they are ready and it works for them.
So basically,
there never is any
if
failure.
they're coming to your office, it's because they're willing for
yes.
it to.
And they have tried everything, and it's their last chance to find what to do and how to do it.
Okay. Well, thank you very much.
You're welcome.
And now let's have a look at this week's testimony.